Septic abortion. Every year, thousands of women face a life-threatening complication that begins with one infection and ends in a race for survival. It's called septic abortion, and today, we are breaking it down in the clearest, simplest way so you can protect yourself, your patients, and the women you care about. Before we dive deep, click like, subscribe, and share, because this video could literally save a life. 1. What is septic abortion? Septic abortion is a serious infection of the uterus following a miscarriage or abortion, especially when the process is unsafe or incomplete. Bacteria enter the uterus, multiply rapidly, spread to nearby organs, and then enter the bloodstream. When untreated, it evolves into sepsis, one of the deadliest medical emergencies worldwide. Stay with me to the end, because I'll show you the early warning signs most people miss and how quick action can prevent tragedy. 2. How does it actually happen? Some pregnancy tissue remains inside retained products. Bacteria take advantage of the open cervix and blood-rich environment. Common bacteria: E. coli, Staphylococcus, Streptococcus, anaerobes. They multiply, release toxins, inflammation spreads. Unsafe abortion practices increase the risk dramatically. Unsterile instruments, home insertions, traditional methods, abortions attempted by untrained individuals. Drop a comment saying I'm learning if this is already opening your eyes. 3. Major causes you must know. Unsafe abortions performed without medical training. Poor hygiene or contaminated tools. Miscarriages where tissue remains inside. Self-induced procedures. Untreated reproductive infections. Delay in seeking medical care after bleeding or fever. Many women ignore mild fever or strange discharge after a miscarriage, thinking it will pass until the infection spreads too far. 4. Warning signs that signal danger. These signs should never be ignored. Even one of them requires medical attention immediately. Symptoms: high fever, lower abdominal pain, foul-smelling vaginal discharge, heavy bleeding or continuous spotting, rapid heartbeat, chills and rigors, dizziness, weakness, confusion, a sign of late sepsis. It's your body's alarm system. When infection spreads into your bloodstream, every organ becomes at risk. If you're finding this information valuable, hit the like button to help this video reach more women. 5. What happens inside the body? Infection spreads from the uterus, fallopian tubes, ovaries, pelvic cavity. Bacteria release toxins, blood vessels dilate, blood pressure drops. This leads to septic shock, which can cause kidney failure, breathing difficulty, confusion, collapse. This is why septic abortion is considered a medical emergency. Minutes matter. Hours matter. 6. How do doctors diagnose it? Pelvic examination. Vital signs check. Ultrasound to detect retained tissue. Blood tests, CBC, cultures. Urine test. Pain assessment. Sepsis screening. Diagnosis is rapid. Doctors don't wait. Treatment begins immediately, because every delay increases mortality. 7. Treatment. What saves a life? Step 1. Immediate 4 antibiotics. Broad spectrum. Covers anaerobes, gram-negatives, gram-positives. Step 2. 4 fluids. To stabilize blood pressure. Step 3. Removing the infection source. Manual vacuum aspiration, MVA. Dilation and curettage, DNC. Retained tissue must be removed. Antibiotics alone cannot cure this. Step 4. Oxygen and organ support. Monitoring kidneys, lungs, and heart. Step 5. ICU care if needed, especially in cases of septic shock. Share this video with someone who works in women's health. This knowledge saves lives. 8. Possible complications. If treatment is delayed, complications can include infertility from scarring, pelvic inflammatory disease, chronic pelvic pain, septic shock, organ failure, death. Many of these are preventable with early medical care. 9. How to prevent septic abortion. Seek medical care for any miscarriage, bleeding, or fever. Avoid unsafe abortion attempts. Always use trained, certified health professionals. Follow post-procedure instructions carefully. Return for checkups if symptoms persist. Treat vaginal infections early. Ensure sterile conditions for any gynecologic procedure. When treated early, most women recover fully without long-term problems. Knowledge saves lives. If this video helped you understand septic abortion better, please like, subscribe, and share. You never know, you might be the reason someone gets help on time.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.